So we're trying to identify the value of the resource, the time, the effort that goes into trying to make these projects happen and be sustained afterwards. So we want to look at that, and we also want to look at the more narrow cost effectiveness of delivering the psychosocial interventions as well. So there's two components, but what's often forgotten when you're evaluating large complex projects is actually the challenge of implementation itself. It's not enough simply to have a fantastic intervention that we know that works, but how does it get sustained? How do you get buy-in from the local population? How do you encourage and work with the Syrian refugee community to get them on board, and also how to train up and sustain the capabilities within the Syrian refugee community, to sustain the project once Strengths is finished, once the funding from the European Commission Union is finished. It's really, in a sense, we want people to tell stories. Tell stories of how they actually go about creating the conditions to implement. How do you build those alliances? How do you build trust on the ground? How do you think about the different incentives and disincentives that people have to get involved? So it means talking to people. Talking to people in the local host countries, talking to people in the refugee community, talking to NGOs, others from previous projects actually that worked perhaps in different parts of the world. It's a lot of talking, documenting, trying to quantify those efforts, time and money and other inputs, and then trying to say, well, this is the value of the actual implementation process, because it's a fundamental thing for funders in future to think, well, it's not just about funding the intervention itself and the delivery, it's about funding and supporting that implementation process. But actually there are broader lessons to learn here about implementation in very challenging contexts of cultural interventions that require a lot of cultural adaptation. It could be applied to physical health interventions as well as mental health interventions. There are lots of lessons to learn, and it's important actually that some of the outputs of Strengths focus on those issues a lot. So taking what we've learned here and transferring it to an entirely different context, there will be common lessons about how you implement things, how you engage with different stakeholders in different countries, how you build alliances, how you actually sustain implementation. There's lots to be learned there, and indeed there's already things we can learn from other places now to help us in Strengths.